Hello, I'm Dr. Ruth Roberts, and I'm your pet's ally, and never has that been more clear to me than today. My profession breaks my heart truly because there are some great vets out there, but there are some really bad vets out there. I was talking with one of my clients today, and she's got the dog has got some significant health issues, but it was abundantly clear to me that this poor pup has had some sort of an infection that's been affecting her kidneys. I mean, literally, her white blood cell count doubled in 5 days. And her veterinarian told her, oh, your dog's in kidney failure because the kidney values had gone sky high. And I am really sorry, but kidney failure does not cause a dog or a cat or a human's white blood cell count to double. However, internalized massive infection certainly does, and it will make the kidney values go sky high because the body can't get rid of waste products fast enough, and as it is fighting off infection, it becomes profoundly dehydrated, which is what caused the kidney values. So I am grateful that my client found a veterinarian that was able to say, oh, heck no, I think I can really help your dog, and gave her the appropriate treatment, which is intravenous antibiotics and intravenous fluids. And lo and behold, the next day, the kidney values had dropped by 50%, and the white blood cell count had dropped significantly. I am so sorry, y'all. I mean, I keep hearing more and more horror stories like this, and it's like if the vet sees the creatinine is even mildly elevated, this is the cause of your dog's illness, and it's not. I had another message from a long-time client in Charleston, Heidi Burt, and Heidi, I mean, golly. So she says, oh, it's me with another emergency, and I need someone I can trust. And her dog Moggy, who's probably 14 by this time, I would guess, maybe older, dislocated her hip, and of course, and Heidi's a piece of work, but she is right there. She is being the advocate for her animals. So she says, and of course everyone wants to cut her open. Any suggestions other than being barbaric? And so I messaged her back and said, if she's dislocated her hip within 48 hours, sometimes closed reduction will work. And, but oftentimes it pops back out. And so once the storm passed through Charleston, Heidi messages me back and says, oh, it's definitely been more than 48 hours, but the vet sent us home because of the storm, and that is a legitimate thing. The hurricane was threatening to hit Charleston pretty much full force at that point, and put her on tramadol, and now she's back to using her leg, walking and even trying to run. Is that normal with a dislocated hip if on drugs? And so I had to message Heidi back and say, one of two things. Either A, the tramadol relaxed her enough for the hip to basically seat itself, or B, it was never dislocated to start with. Guys, wow, I am so sorry, and I hate this because this means you have to be dubious about much of what your veterinarian has to tell you and get it checked out. I mean, I just have no words. I am horrified that in the first story I told you, my client almost put her pet to sleep because this is what her veterinarian was telling her, and she was also being told that she was being cruel for continuing to keep her pet alive, when in fact her pet had been misdiagnosed. Second opinions. If you don't think things are right, what you're hearing doesn't sound right, it doesn't seem right, it seems incredulous, it may well be. I mean, sometimes it can just be crazy, but get a second opinion. Whether it's another veterinarian that other friends in your town trust, whether it's me, whether it's somebody else, find somebody that can help you work through what is the truth and what is not the truth. So that's what I've got to say on that. I had a couple of questions that I'll answer here this week. Gay's asking about her dog Jill, who's a Sheltie, who's somewhere between 10 and 15 years old, and she was diagnosed in April with lymphoma after a surgery for a sarcoma in the mammary area and a second surgery 30 days later for mast cell tumor. Holy smokes, Gay. That is crazy, and it sounds like Jill's body is just bent on making tumors, which means that things are way, way, way out of whack. There is a cancer support protocol on our members site, which I hope you will go over and check out. That's completely free to join. You can get some basic information there. If Jill is making that many tumors and that many different tumors, something is way, way askew. And frankly, the first place I would start is in supporting her gut, because that's going to help her immune system function better, and then also work on reducing the pro-inflammatory diet she may or may not be eating. You don't mention much else from there. I would also consider a keto diet. If she's a Sheltie, she may have had problems with elevated triglycerides and or pancreatitis. If either of those things have happened, that may not be a great idea to just launch into, but it may be something you can approach a little bit more slowly. Again, I'm happy to work with you as a consulting client. And if you'd like more information on that, I'll put some links below. And actually, I'll just throw this out there for everyone. I am truly aghast at my colleagues. And so, I'm not cheap, but I do take time to go through all of your records and come up with things that other people aren't able to see. And so, again, we're trying to get holistic total body support out to people to use it. And so if you purchase a consultation from me this month, I will send you a dozen free holistic total body support of either dog or cat, whichever flavor you need. So Gay, again, I'll put the link for the free members area. Check out the cancer support protocol, and that will get you some starters. But I think I can help you with Jill as far as getting a better game plan together. But that's if her immune system is that whacked, you really have to start working with the gut to help it work better. And the reason that's important is that 70% of the immune system resides there. So if we can get that working better, that's awesome. And there's some codicils around chemotherapy, but that's a great place to start. And then Cindy is asking about her dog Bandit, who's also about 10 to 15 years old and sort of a mixed breed, and he was just diagnosed with chronic kidney disease, and his BUN was 50. So Cindy, BUN is more of a reflection of hydration status, and the one that I really kind of hang my hat on is the creatinine level. So if that is normal or not terribly elevated, take a deep breath and head over to the kidney support protocol, where that's going to tell you to feed cooked food so that you will be able to add more moisture to Bandit's diet and help flush out help the kidneys work a little bit more efficiently. And then the other big home run supplement there is quercetin. And what that seems to do is to reduce the deposition of advanced glycosylation end products, which is a big fat mouthful. Its acronym is AGE, AGE, which is extremely appropriate because that's what it does to the kidney, is it ages it prematurely. Quercetin seems to reduce that from happening. And so what we've seen over the years in many of my patients is that either the kidney values stay the same, or in some cases they will improve. So for instance, with one of my own dogs, Ollie, and I talk about him all the time, he was the biggest buffoon. He's actually living with with an ex who was his first dog mommy, so he's happy as a clam. But over the years, his creatinine went from 3.6 at 3 years of age to 0.7 at 9 years of age, and he is now almost 12 and doing just peachy. So don't get freaked out. Take a deep breath and realize that the way veterinarians teach you to feed dogs with the bag of food and all of that, and that's a lot of what's creating the problems for you. So I hope that is helpful, Cindy. Let's see, I mentioned last week that my app is available, and I have the Android link for that, so I will put that and the Apple app link as well down below in the comments. App is completely free. We are working on getting it hooked up to the existing membership area, so if you've already joined that, you don't have to have another set of credentials. But the goal is to give you more current information, and if you've been following me for a while, some of it won't be as relevant because you've been watching it, but this will have multiple videos that have been extremely popular and provided people with the information that they needed, and blog posts and access to our store, and another way to ask questions. If you'd like me to answer your question on this weekly video broadcast, just head over to my website, drruthroberts.com, click on the Ask the Vet button, and fire away. You can also message us, and that is a much more rapid way to get a message out to us. And what will happen is my assistant Melody will load these up into a document so that I'll go through these each week and answer them for you all. That's what I have for you this week. Until next week, remember, your pet's best health starts in the bowl. I'm Dr. Ruth Roberts, your pet's ally. Take good care.